Welcome. Today we're diving deep into a rare and often misunderstood lung disease, lymphoid interstitial pneumonia, or LIP. We'll explore its causes, how it affects the lungs, and what can be done about it. So, let's begin uncovering the facts about LIP. The exact cause of LIP remains a bit of a mystery. However, it's strongly associated with underlying conditions, particularly autoimmune diseases like Sjögren's and systemic lupus erythematosus. In children, it's frequently linked to HV infection. Other potential associations include certain viral infections, such as Epstein-Barr virus, and less commonly medications or exposure to environmental triggers. Essentially, LIP appears to be a reaction of the lungs to an immunological challenge. Now, let's talk about what's actually happening inside the lungs. In LIP, there's an abnormal accumulation of lymphocytes, a type of white blood cell within the lung tissue, specifically in the interstitium. This is the space between the air sacs, or alveoli. These lymphocytes infiltrate the interstitium, thickening it and disrupting the normal gas exchange process. This infiltration can lead to inflammation, scarring, and ultimately impaired lung function. Think of it as the lung's immune system going into overdrive, causing unintended damage. LIP is a relatively rare condition. Due to its association with other diseases, pinpointing the exact prevalence is challenging. It's more commonly diagnosed in children with HIV infection and in adults with autoimmune disorders. While rare in the general population, LIP is an important consideration in patients presenting with unexplained lung problems, especially when accompanied by systemic symptoms suggestive of an underlying autoimmune condition. The signs and symptoms of LIP can be quite varied and often develop gradually. Common symptoms include a persistent dry cough, shortness of breath that worsens with exertion, and fatigue. Some individuals may also experience chest pain, weight loss, fever, and night sweats. Because these symptoms can overlap with other lung conditions, a thorough evaluation is essential for accurate diagnosis. Also, extrapulmonary manifestations related to associated conditions like Sjögren's, such as dry eyes and dry mouth, can be present. Diagnosing LIP requires a multifaceted approach. It usually starts with a thorough medical history and physical examination, followed by imaging studies such as a chest X-ray or a high-resolution CT scan. These scans often reveal characteristic patterns of lung involvement, like ground glass opacities and thickening of the interlobular septa. However, the definitive diagnosis typically requires a lung biopsy. This involves taking a small sample of lung tissue and examining it under a microscope to confirm the presence of lymphocyte infiltration and rule out other potential causes. While LIP doesn't have universally recognized distinct types or classifications in the same way as some other lung diseases, it's critical to classify it based on the underlying associated conditions. For example, differentiating between LIP associated with HIV, Sjögren's, or other autoimmune diseases helps guide treatment strategies. The presence or absence of other lung abnormalities or infections also influences classification and management. Treatment for LIP focuses on managing the underlying cause and reducing inflammation in the lungs. For individuals with HIV-associated LIP, antiretroviral therapy is crucial. In cases associated with autoimmune diseases, immunosuppressant medications like corticosteroids or other immune-modulating drugs are often used to suppress the immune system's overactive response. Supportive care, such as oxygen therapy, pulmonary rehabilitation, and management of any co-existing lung infections, also plays a vital role in improving quality of life. Unfortunately, there are no specific preventative measures for LIP itself, given that it typically arises secondary to other underlying conditions. However, managing those underlying conditions, such as ensuring adherence to antiretroviral therapy for HIV or effectively controlling autoimmune diseases, may indirectly help reduce the risk of developing LIP. Avoiding potential environmental triggers, like exposure to certain toxins or allergens, may also be beneficial, although definitive evidence is limited. The prognosis of a LIP varies significantly depending on the underlying cause, the severity of lung involvement, and the individual's response to treatment. In some cases, with effective management of the underlying condition, LIP can be stabilized or even reversed. However, in other cases, especially when the disease progresses to significant scarring or fibrosis, the prognosis may be less favorable. Recent research focuses on identifying biomarkers for early detection and developing more targeted therapies to minimize lung damage. Investigational therapies targeting specific immune pathways are also being explored. Ultimately, the best approach is early diagnosis, appropriate treatment of the underlying condition, and ongoing monitoring to optimize lung function and quality of life.